First, let's just try and clear this up. What's your advice to the public today if they need to call 999 and want an ambulance sent?
Well, it's to use their common sense. The system will be under very severe pressure today. The trade unions have refused to give national exemptions in terms of all life-threatening and emergency calls. They've said that they will prioritise those, but it'll be down to local agreements with trust and indeed some decisions taken in call centres. So the system will be under significant pressure, and therefore we're saying to the public to exercise their common sense in terms of what activities they do, being mindful of the fact that there are those pressures on the system.
Should local decisions, are they not the best ones to take rather than having a national plan? Is that one of your concerns? There is no national contingency plan in place. Isn't that your job?
Well, the difficulty of putting contingency measures in place is given the uncertainty as to what exactly is and is not being covered, and the fact that those decisions in some cases will be taken on the day. But it's also the case that even what's referred to as Category 3 urgent calls are often very serious as well. So we're doing all we can with NHS colleagues to put in place contingency measures. We've got the army, we've got volunteers, we've got community services, we've got frail elderly services in terms of people that might fall. So there's a range of measures from a contingency perspective that we've been putting in place, but there's obviously limits to what that can be done. And therefore it is down to the trade unions in terms of what exemptions they provide. And the concern is particularly if services are taken from the picket line, that adds further confusion on the day and potentially delays responses.
Secretary of State, you said in your piece this morning in the Telegraph that the only way to resolve this is by talking. The unions want to talk to you, they keep saying that, but they want to talk to you about pay. So why won't you do that?
Well, we have a process in terms of pay, an independent process, and we've accepted the recommendations in full, and that looks at both the pressures on the NHS and indeed at the autumn statement, additional funding was targeted to the NHS. The Chancellor allocated an extra £6.6 billion to the NHS, but he also put in place the biggest ever increase in social care funding, an extra £7.5 billion over the next 2 years, and that recognises, particularly for paramedics, one of the biggest issues raised with me when I was talking to ambulance staff on Sunday evening. Actually, what they said to me was more important than pay was the frustration around handover delays at hospitals, and they're often caused by the delay in getting patients out of hospital who are fit to be discharged. That's why the Chancellor invested the extra £7.5 billion in social care, an extra 200,000 social care packages. So we're investing in the NHS, we're investing in social care, and I don't want to divert money from those essential services focused on patients to overturn what has been an independent process which has looked at what is affordable to the economy, what is affordable to your viewers at a time of cost of living pressure, but also recognising the system's under very severe pressure and we need to get that extra investment into the NHS and into social care.
We'll come back to some of the points you make there in a moment, Secretary of State, but I just want to read you what's been said by the NHS Providers and NHS Confederation yesterday. They said that the fear of NHS leaders is that the risk to patients is only going to get worse with future strikes planned. That is, unless the government is able to reach agreement with the trade unions to bring a swift end to the dispute. Now, that's not the unions saying that, that's not nurses saying that, that is the NHS providers. And this is on the government, on you, to come to an agreement.
Well, we have, as I say, accepted in full the pay review body recommendations, but that's in addition to last year.
Sorry, Secretary of State, let me just interrupt you there, sir. I'm sorry to do that, but you always talk about the pay review bodies, and you know, as well as I do, that the pay review body is not always listened to. Back in 2014, the pay review body recommended a 1% increase in NHS pay. That was rejected by the now Chancellor, Jeremy Hunt. In 2018, police officers were recommended a pay review increase of 2%. That was rejected as well. So you can make a decision to not listen to the pay review body. Why are you not doing it in this instance?
And when we have done that, you have been the first, I'm sure, to criticise us for not respecting the independence. The difference here is we have accepted those recommendations in full because we recognise the system coming out of the pandemic has been under pressure. So we have accepted the recommendations in full, and that comes on top of last year when the rest of the public sector had a pay freeze. We prioritised the NHS with an extra 3% rise when many other people were facing a pay freeze. So we have prioritised the NHS. We've accepted in full the independent pay review body's recommendations, but we've gone further and we've put an extra £6.6 billion into the NHS and the record funding into social care, because we recognise the huge strains the NHS is in as a consequence of the pandemic. And it's important that we focus on those patient services to clear the backlogs in operations, to address the handover delays, to get the support into primary care for GPs, because that's where the system is under most pressure.
Let me put it to you like this then, Mr. Barclay. Without having staff in the health service because they're not being paid, they're not working in the right conditions, you won't be able to improve those services and treatment outcomes.
Well, pay is a factor. I mean, the basic pay of a paramedic, the average pay of a paramedic is $34,300. But when you add in overtime and unsocial hours, that's an extra 37%, takes it up to $47,000. On top of that, you get a 20%, a fifth, going into pension as well. So we have listened to the recommendations of the pay body on pay. But pay is just one of a number of factors. We also look at the fleet. We're investing in more ambulances. We're putting more money into ambulance trusts, an extra £150 million. We're also investing in call centres because we're seeing very significant increases in pressure on the number of calls that ambulance trusts are facing. So we put an extra £50 million into that. And as well as that, we recognise there's a particular issue in terms of the elderly, those elderly people that fall, the need to get services to them. That's why we've been working with partners like St John's Ambulance, an extra £30 million in to get St John's Ambulance targeting those elderly falls. So we're investing more in the system. We're doing that within the context of an independent process that looks at pay, but it's also important that we tackle some of these system pressures, particularly around social care. That's why we put the record funding into that, and that in turn has a very big impact on paramedics.
That is going to take a while to feed through, as you well know. Now, you mentioned in the Telegraph today that striking workers are taking a conscious decision to put patients at risk. That's not conciliatory language. That's not going to bring the two sides closer together. That's only going to harden the side against you, isn't it?
Well, it is just a reflection of fact. The trade unions have chosen this time for the strike. We saw over the last week a 73% increase in flu admissions to hospital. We saw a 27% increase in COVID admissions. We've got 5 times the normal prescribing rate of prescriptions for antibiotics in terms of strep A. We've had a massive increase in calls to 111, up by more than a third. We've got an increase in calls to 999 over the last month of 15%. So the system is facing very significant pressures as a result of flu, of COVID, of strep A. And it's at this time that trade unions have not only chosen to strike, but have refused to put in place national exemptions to say they will cover all of the life-threatening and emergency Cat 1, Cat 2 calls. That in turn makes the contingency measures much more difficult to plan.
Secretary of State, and I'm sure the unions would say that they're not putting patients at risk. You're actually putting patients at risk by not being willing to discuss their pay requests. Now, this has been solved in Scotland by meeting the pay requests of striking staff there. Would the government go to something like that, 7.5% for nurses, to try and resolve these strikes?
Well, one of the big misconceptions about the deal in Scotland, and incidentally, the GMB were opposed to the deal in Scotland. They're one of the trade unions that are striking. But it wasn't simply 7.5%. If you add in all the other measures in terms of reducing hours, extra annual leave, changes to the way overtime is addressed, protected learning time, actually the cost of that is much more significant. And as I say, one of the trade unions has rejected that as well. But what we want to do is focus on patients, get that investment into the NHS, into social care, address the blockage. There are patients that are ready to leave hospital who it's not in their interest to stay. So get that social care and flow working. That is what we prioritised. And we've done that whilst also listening to what is an independent process around the pay review bodies. We've accepted those recommendations in full, and that builds on the extra 3% we awarded last year at a time when other public sector workers faced a freeze.
OK, Steve Barclay, thanks for being with us.